Hello. This is a presentation on the COVID-19 pandemic and its effect on your personal finance. This presentation will consist of 4 parts. The introduction includes the personal experience of the group members. The analysis will provide an overview of the COVID-19 pandemic. We will also explain how financial psychology connects to the pandemic and offer our recommendations on how this issue can be resolved. My name is Rana Atta. I am currently a sophomore majoring in psychology and minoring in sociology. Ever since the start of the COVID-19 pandemic, there had been drastic changes in my life. Changes such as having to wear a mandatory face mask, having online classes, and being fired from my job. Due to all these changes, I've developed certain unhealthy money disorders because of all the stress the pandemic has caused. Prior to the pandemic, I used to shop, but not as much as I do during the pandemic. According to Clones, this can be categorized as having a compulsive buying disorder.
My name is Zainab Akhtar and I'm a sophomore in college. My major is in finance and my minor is in psychology. At the start of the pandemic, I was spending and saving wisely as we didn't know what the future held. But as months of quarantine passed, I began impulsively shopping, also known as compulsive shopping. I'm realizing more that these spending habits will not help me manage my future finances. Analysis of the issue. What is the COVID-19 pandemic? COVID-19 is a respiratory illness that causes symptoms of fever and cough. Being infected results in a 14-day mandatory quarantine. According to the CDC, the Center for Disease Control and Prevention, COVID-19 is thought to spread mainly through close contact from person to person, including between people who are physically near each other. It started in December 2019 when a scientist in Wuhan, China, confirmed a mysterious pneumonia-like illness that was never seen before. China declared a strict lockdown in Wuhan. 2 days after this discovery, the first case in the U.S. was recorded. As cases began to multiply, countries all over the world began restricting travel and social interaction. COVID-19 was only declared a pandemic on March 11, 2020. The phrase essential job was coming up in the news more and more as weeks went by. Many lost their jobs as companies and corporations had to shut down and couldn't afford to employ that many people anymore. Only a month later, borders were sealed and businesses shut down. Around this time is when essential items such as bottled water, certain foods, and toilet paper were in shortages. While it was joked about on the internet, food insecurity was a real threat to many. While those who could afford it stocked up, many of those who couldn't afford it had to wait it through. Schooling shifted online. This ensured that education would continue without risk of spreading COVID. Teachers could teach remotely and students were provided laptops and iPads to continue from home. Those who didn't have an internet connection were accommodated as well. China was the first country to have a recorded case, but as there were no regulations in place in terms of travel, the spread of cases was fast. Taiwan soon followed with their first confirmed case. Soon after, Singapore followed. The spread of cases reached throughout Asia into Europe and through travel to North America within a few weeks of the first case. As of May 2021, all countries have been affected. Because many countries were affected, borders began closing and flights were restricted to emergency only. Little to no money was being made in traveling. At the very start, many countries were quick to officially shut down borders, but within the US, the regulations were enforced one state at a time. A case count chart provided by the New York Times shows the spikes in the US cases. The line measures the number of new cases that day, with January 8th of 2021 having the most new cases in a day at 300,000 cases. NYU Langone researchers tracked the pandemic spread, making it easier to understand how fast the pandemic spread. Although the COVID-19 pandemic affected everybody, these 4 groups make it easier to understand who was affected. Age-wise, it was recorded by the CDC that older people are being affected the most. Race-wise, according to the CDC, Asian persons are as affected, if not slightly less than white persons. But Black persons' hospitalizations and deaths are doubled in comparison. Native American and Hispanic Latino hospitalizations are tripled in comparison to white persons, and deaths are doubled in comparison. Provided by the Pew Research Center, a survey done in August 2020 about the socioeconomic trends due to the COVID-19 pandemic, Asian persons struggled 4 to 5% more than white persons statistically in terms of trouble paying bills, paying rent and mortgages, and having to get food from food banks. The struggles of Black and Hispanic persons were very similar to the statistics of those who had to pay bills using savings accounts and trouble paying rent and mortgages. These percentages were also at least 10% higher than Asian persons. Income level. Within the sample group used to conduct the survey, 5% of the upper income class had trouble paying bills. 19% of the middle income class had the same struggle. 46% of the lower income class struggled. In terms of food scarcity, 1% of the upper class had gotten food from a food bank. 12% of the middle class did the same, and 35% of the lower class. Education level. There was little information about different education levels being affected by COVID-19, but the research provided by the PRC stated that there were similar statistics between those with high school or less, some college, and bachelor's and more. Roughly 4 in 10 adults say they or someone in their household lost a job or wages because of COVID-19. COVID-19 is a problem in terms of financial psychology because it has created a time where it is hard to have a job, but you need money to buy regular essentials as well as medical essentials, meaning more hand sanitizer than usual and masks. Many have had to dip into their life savings and retirement funds to have enough money to pay rent. While rent relief and eviction bans have been in place, many people are still struggling. There are some positives that the pandemic has brought out. The start of the pandemic resulted in a decline in the stock market, and recent research by the BBC has shown that certain stocks are doing better than what they once were right before the pandemic began. This is a result of many people learning how to manage their finances themselves and wanting to build wealth and have many income sources. Some have even invested in real estate to create new streams of income. There are still many downsides that will affect the economy in the future as well. Many countries are struggling with rising unemployment. The government is providing unemployment while the country's tourism industry is down. This poses an issue because this is unrealistic for the future. Countries making no money through sources that were flourishing pre-pandemic. The majority of the countries are in recession. China was the only major economy to grow in 2020. Applying the course material.
With the start of the pandemic, many people who once believed they were financially secure are going through an event they never thought they would. Living through the pandemic has made some scared to spend, and a few realize that their lifetime of working and saving means nothing during the pandemic. Those who worked hard to get office jobs and work in business fields struggled because they were declared non-essential, but those who worked in healthcare and minimum wage jobs at grocery stores were made essential. People experiencing money disorders such as money denial may be forced to deal with their finances during the pandemic. People dealing with money denial ignore and don't like to deal with their finances or financial issues. People who were once in financial denial are now tracking and saving and managing their personal finances, which is something positive. On the contrary, certain individuals may have developed a money disorder during the pandemic. Since there's a significant rise in online shopping, many individuals may suffer from compulsive buying disorder. Compulsive buying disorder is when an individual has a significant need to purchase things when they experience anxiety or stress. Due to a lot of people losing their loved ones, their jobs, and having a hard time conforming to the new norm, they might like to shop to get instant gratification, which feeds their ego and disorder.
Different money spending habits may help or hinder a person's savings and spending skills. Research done by JP Morgan on consumer spending habits due to COVID mentioned how, due to panic buying, retailers around the world are forced to limit the number of purchases on high-end items, such as hand sanitizer and toilet paper. A diagram referring to the U.S. market growth across staple categories shows that in March 2020, there was a spike in the market for health and personal care, as well as a spike in food. There has been an increase in U.S. e-commerce sales by 44.5%. There are no COVID-free countries, but a few countries are on the border of claiming this title. Australia has had an average of only 9 new cases this week. New Zealand has had an average of 2 new cases a week. On February 2nd of 2020, when New Zealand was made aware the cases were spreading outside of China, they banned entry to those coming from China and introduced a 14-day isolation to those who came from China. Not long after, the Prime Minister of New Zealand closed the borders almost entirely to non-citizens. This approach affected its economy. The international border closure in New Zealand hit the country's tourism, decreasing retail sales and hotel bookings. The Financial Times said overall economy activity dropped 1% compared to the previous quarter, well below consensus forecast for a modest 0.2% rise in gross domestic product. Economists are saying that a second recession might make its way to New Zealand. Because of the decline in the fourth quarter, domestic product is expected to decline in the first quarter. The U.S. has had 32.9 million cases in total. Based on the timeline of New York during the pandemic, it can be seen that there were many attempts to return to regular life. In an attempt to keep businesses going, the city government made attempts to reopen restaurants and diners and outdoor attractions. The effects on the economy were that compared to February 2020, February 2021, unemployment rates have doubled, and urban areas such as New York City have at least tripled. They chose to keep on opening even after closing multiple times to allow businesses to make profit and help the economy. Another country greatly affected is the UK, which has had 4.4 million cases in total. The timeline of the pandemic in the UK shows how there were numerous attempts at opening back up to the world. The effect the pandemic had on its economy is that employment levels fell by 9% since the state of the pandemic. Claiming unemployment benefits increased by $1.4 billion between March 2020 and March 2021. The back and forth opening and closing is all to try to financially get back to how things used to be. Opening up hairdressers and movie theaters all while a pandemic is going on isn't the smartest thing to do, but this was done so people can keep on making money to try to increase employment rates and decrease the amount of unemployment being collected. Both the US and the UK keep reopening because the economy needs money. People need money. Continuing to work is the only way people can try to get a handle on what is going on.
On a macro level, something that has been really affected during the pandemic is the death toll. So far, there have been 161 million cases of COVID-19 cases, and there have been 3.35 million deaths so far. On another level, tourism has been hugely affected. There are so many countries that benefit from tourism. For many countries, tourism is what helps fuel their economy, even making 20% of their GDP. Since tourism supports 1 in 10 jobs, it can lead to lots of unemployment. Which leads us to the last point. Unemployment. Due to the pandemic, there was a need for people to socially distance themselves in order to stay safe, and because of this, most businesses and public areas were closed, leading to millions of Americans being unemployed. 9.4 million jobs were lost in 2020, which means that many more were left unemployed. On a micro level, people's spending and saving habits have changed. According to the CNBC, 64% of Americans have changed their spending habits during the pandemic. The pandemic has also led individuals to see the importance of savings and have prompted them to save even more. Over 50% of consumers report saving a lot more during the pandemic. Also, the pandemic negatively affected African Americans on a micro level. And this is largely due to environmental, economic, and political factors that have compounded for generations, putting Black people at a higher risk of chronic conditions. Lastly, price adjustment issues. Overreacting caused a lot of overpurchasing, and as we all know, there was a shortage of toilet paper because of this. Also, supply and demand caused things like hand sanitizer, disinfectants, soap, and face masks to be hard to find and to fluctuate in prices. Hand sanitizer sales soared by 1,807% in 2020. For recommendations, I would recommend you to see a financial coach, and financial coaches can always help you set goals, and they can assist you with changing your current financial behavior and money management skills. Also, you can also see a financial counselor, and a financial counselor is basically going to help you make financial performance improvements that meet your individualized goals set mutually between you and your counselor. Lastly, you can always educate yourself if you don't have a money to reach out to a financial coach or a financial counselor, and there's a link provided for anyone who's interested in that. But when you financially educate yourself, you can always be able to apply anything that you learned to your current situation and help you make better financial decisions. These recommendations will most likely work because most people falling into debt are people who lack education and information. According to Rainick, 30% of Gen Z said that the financial subject they understood the least was debt management, falling behind investing, insurance policies, coverage, and creating a financial plan. As I stated before, you can always see a financial coach or a financial counselor, and these two people are professionals and they can also help you create a financial plan. But if you don't have the money to afford the luxury of getting a financial coach, a financial planner, or a financial counselor, you can always just go to the website I listed on the previous slide to help educate yourself into making better financial decisions. So, this is the end of the presentation, and we thank you for listening. And we also look forward to hearing you guys' feedback. Bye.